Hello. I'm going to be assessing you today. I'm going to be looking at your neuros and doing your musculoskeletal, okay?
Okay.
So the first one is sense of smell. We're going to skip that one for now, but this would be, I would be putting something under his nose so he can recognize the smell. Next would be, we're dealing with the optic nerves, that's the peripheral vision, and also doing a Cillin chart. We're going to do your movement. So I want you to follow my finger and just follow with your eyes. Up, down, back, down, over, the side, up, down, up. Perfect. And then next we're going to move back to the light. So I want you to stare behind me at an object behind me. And then I'm going to look here. Good job. And then I'm looking for constricting of the eyes. Your facial sensation, I'm just wondering if you would use a cut and make sure can you feel me here?
Yes.
Here?
Yes.
Here?
Yes.
And then the next one would be for a gag reflex. I don't have a tongue depressor, but I would be looking to see if the gag reflex when I use a tongue depressor. And then I can see that you're talking and without any coarseness. Any problems with swallowing?
No.
Beautiful. And then your next would be moving your head up and down, side to side. Awesome. Any pain when we're doing that? Anything restricting?
Nope.
Good. And then stick out your tongue, and I'll move your tongue side to side. Good. All right. So all done there. So great. So the next we're looking at your fingers. So for this, I'm looking at your hands. No swelling, no deformity. Everything looks bilaterally equal. Any tenderness when I'm palpating?
No.
Awesome. No nodules. I see some scars from scrapes and stuff on your fingers and some moles. And everything else looks good. Looking at the cap refill on both sides, and they are +2, which is normal. Okay. And then I'm also going to do your pulses. And I'm going to do that both sides. And they're equal on both sides. Warmth is good. Color is pink. Skin integrity is good. And next I want to take your fingers. I want you to flex them up and down and go side to side. Can you take your thumb and move it around? Good. That looks good. So that is your flexion, extension, and your abduction and adduction. And then next I'm going to have your grip. Nice and tight. Good strength. 5 out of 5. Awesome. And then I'm looking at your wrist. Again, palpating. Looks good. Cap refill's good. No swelling, no deformity. Any tenderness?
No.
And no nodules. Everything looks symmetrical. Now I want to take your wrist, bend them down, up. Have your wrist go out and in circle. Awesome. Any pain, anything restricting?
Nope.
All looks bilaterally. Good. Elbows, same thing. Flex them out. Bend them in. Good. And then height, can you do hyperflexion? So it's really to extend. Good. Excellent. And then no tenderness when I'm palpating.
Nope.
Good. Shoulders, I want you to go up with both hands. Sorry. And down. Now go back. Oh, stand up for me on this one. There we go. And then rotate your shoulders. Any pain or anything?
Nope.
Good. And then now I want you to take your thumb. Can you touch your fingers with each of your thumbs? Perfect. Both sides. Awesome. And then can you take your hand, put one hand on top of the other, and flop your hands back and forth? Good. Can you do the other side? Awesome. All right, and the next thing I want you to do is stick your hand out. I want you to close your eyes and see if you can see what I'm tracing.
D.
Yep. All right, and then that is good. I don't have a reflex hammer, but the next thing I would be doing is your reflexes. I would do your brachial, radial, your biceps, your triceps, your patella, and your Achilles. So the next thing we're gonna do is your hips. So I want you to, I would inspect for any swellingness, any tenderness in your hip area.
No.
Good. And then I want you to raise your leg out. And then raise your leg in towards you. Good. And then I want you to kick out and kick back. And do and do with the other side as well.
Forward.
So forward, backwards, out, to the side, and back in. Good. And then can you bend your knees up? Good. And both sides. Good. And can you kick back? Good. Both legs. Perfect. Any tenderness up in the area?
Nope.
I don't hear any crepidus when you're doing that. That's good. And then the next thing we're gonna do, your spine. Can you bend forward? Good. I don't see anything with scoliosis. Awesome. Stand up. Can you bend backwards? Awesome. And then can you go laterally, side to side? Good. And can you also then twist? Any pain with the twisting?
Nope.
Good. All right. Now, balance-wise, close your eyes. And good. No loss of balance. Good. All right. And then can you put your palms up, straight out? Good. No drifting. That's what I'm looking for there. There you go. Now I want to see your ankles. You can sit for this if you would like. So we're looking at your ankles. Bending and internal, external, and then rotate all the way. And the other leg as well. Perfect. And same thing, intern, rotate, and circles. Excuse my child. She's fine. Okay, and the next thing we're looking for is your toes. Can you take your shoes off for me? So I'm looking for your toes as well. Any pain when I'm pressing up on this?
No.
No edema. Good. Skin looks good on both sides. Awesome. Now can you point your toes down, up, rotate your toes in the circle? Perfect. Can you take both feet, push against my hand? Excellent. And up. Good. And then can you also push, resist against me? Awesome. On both hands. Awesome. Also this way, on the wrist. Go against me. Perfect. This way too. Awesome. And then the next thing would just be to walk. Can you walk from heels to toes? Good. And then I want to do a deep knee bend. Good. And then can you hop on one foot? And the other side as well. Awesome. All right. And that ends our exam.